Hello and welcome to this edition of EC3 HOSA Medical Moments. I'm Gina Ryan, Director of Hardin County Educational and Community Television, and today we have Terry Bergen with us again. She is the Public Information Officer for the Lincoln Trail District Health Department. Terry, thank you for coming in.
You're welcome.
It's been a little bit since we've seen each other, but since we are socially distanced, we're going to remove our mask here and talk about the current situation that the county is in, the state's in, your development district, the services that you all provide, and where we're at the present time. We know we are on the uptick. I think I just heard, and of course the day that we tape this, it can change by the afternoon, that 37 of the states are experiencing some of the highest numbers seen yet. And so what is causing that?
Well, we are, it just is an indication that COVID-19 is spreading rapidly within our communities. So, you know, within Lincoln Trail District service area itself, all of our counties are either in critical spread or in accelerated spread. And so that those high cases is just an indication of that. When we look at the total number of cases that we had, say from March to the end of September, we had about 2,700 cases, right? The last 3 months, we've increased, the number of COVID cases, new cases has increased by over 200%. This is in the last 3 months. And when we look at October alone, we've increased by 43%. Now, from March to September, 2,700 cases. In the month of October, to date, 1,200 cases.
Oh, wow. Just in 1 month.
In 1 month. So it will probably be, it is looking that it is going to be the highest number of cases that we've experienced in 1 month since it started.
Today you specifically came in to talk about testing and the availability of testing. So tell people where it's available and what this test can provide for them.
Okay, so we are working in partnership with the Kentucky Department of Public Health. We are one of several health departments within the state that is part of a surge testing pilot program that provides free COVID-19 testing to individuals, anybody, pretty much anybody that wants it. We are particularly interested in those individuals who have traveled recently out of state, individuals who have insurance or don't have insurance, people who are symptomatic or not symptomatic. You don't need a doctor's order to get tested. You just come see us. We're testing in all 6 of our counties. We're also testing in partnership with Breck in their county as well. So we'll be providing testing at Breckenridge. The hours are the same no matter the location. We'll be there from 10 a.m. to 3 p.m. On the days that we're there. Today we're at the Lincoln Trail District Health Department on 108 New Glendale Road. And you can go on to ltdhd.org and schedule an appointment. Now we highly, highly recommend that you schedule an appointment because it kind of helps us prepare to receive whoever's going to receive that day. But we also accept those individuals who just drive up.
Is there a cost involved?
It is completely free to whoever comes and wants to get a test.
And what type of test, what type of model is it? Is it nose swab or throat swab?
It is definitely the nose swab. It is not self-administered. LTDHD staff will be administering the swab, and it will take anywhere from 2 to 3 days for your results to get back. Now, if you, once we register you, you opt in to receive negative results by text. So we won't call you personally to let you know if you have a negative test results. It will be text to you as I mentioned, when you register as part of the registration process. If your tests are positive, we'll be calling you.
Are there any new trends that you're seeing in your development district? I know that the numbers are up. What about ages or just trends that you see?
Well, what we see is that when we look at district-wide, it still is majority female, white female, who are testing positive for COVID. The average age for the district is 42. When we look specifically at Hardin County, it's 40, about 40 years old. As I mentioned, most of them are white, female, and the common symptoms, the symptoms vary from person to person. So, that pretty much is the same. You can have cough or diarrhea or abdominal cramps or fever, nausea, vomiting. What's unique to COVID, though, is that loss of taste, a new loss of taste or a new loss of smell.
With flu season hitting about the same time, should someone, if they feel like they've got those symptoms coming on, do they go to their doctor or go to get tested for COVID? Well,
with flu season, you know, COVID, signs and symptoms mimic a lot of just other illnesses. It's
allergies,
just hard
colds.
Yes, allergies, colds, flu. I mean, it could just be a gambit of things. If you're talking to your healthcare provider on a regular basis, he should be able to direct you on whether you, if it's something that he is concerned about, or even if you're concerned about whether you should get tested or not. The testing is available right now, so if you want to get tested to be sure that it's not what you think it is, it's not COVID, come see us. Anyone who wants a test, we're testing right now.
So they really don't have to know anyone that has tested positive or anything like that. If they just feel like they have, well, you're really encouraging everyone then.
We're encouraging everyone to get in and come to get tested, but as I mentioned, we're also looking for individuals who had traveled recently. You know, they might be concerned about that, who may have had a recent exposure to COVID, and they're concerned about that, and they want to come in. If they have symptoms, they could definitely come see us. If they're asymptomatic, as I mentioned before, they can come see us. We're trying to remove those barriers that may keep people from being tested. And so we encourage, if you, for whatever reason, have to go to work on a particular day and can't get in to get a test, and you can come between our hours to 10 to 3, come see us. We'd love to see you and get you tested.
Has the health department's role changed at all during this huge push that's been going on?
Well, it's just an additional responsibility that we have assumed up until December. So the testing will occur from today, because this is our first day, up until the middle or towards the end of December. We'll be testing.
How hard is it now to do the contact tracing?
It is becoming, it is really straining, our public health resources. So I'm so glad you asked me about that, Gina. I really am. Because previously, we would try to get in contact with individuals within 24 hours. That's just not happening anymore. And I'll tell you why. There's several reasons why that's not happening. One, there's a delay in the way that the lab is reported to the health department. We're averaging about 3 to 5 days right now as far as when we actually receive the lab.
So the person could pick it up. Does the person get their own results?
They know before we will.
Okay.
And so what has happened is that a lot of time people will get their lab result and they say, well, I haven't heard from the health department. It's because we don't have your lab. And so that is one of the things I want to clear up. Once we get that lab, we can start the process. And so the lab is then assigned to a disease investigator who then begins to make that call. But because of the uptick in cases, it pushes that person further back in the queue. There are so many people ahead of you that have to be assigned, and then we also, once we get to you, we assign you to a case, but it still delays the process of notifying people. So what we want them to do, once you realize that you are definitely a confirmed case, and you know who your close contacts are, and I want to go over that definition. So a close contact is anyone who is within 6 feet of a confirmed case for a cumulative total of 15 minutes or more. So what that means is that you can be in contact with a confirmed case for 15 minutes, right? Just one at one time, that counts. But what also counts is these episodic minute conversations that you have with a confirmed case. If you talk with a confirmed case for 3 minutes and then walk away, come back 2 or 3 hours later, talk to them for 5 minutes, walk away. If that adds up to 15 minutes over a 24-hour period, you consider it a close contact,
Wow.
even with your mask on. Of course, if you share eating utensils, if the confirmed case coughs or sneezes directly on you, counts. If you come into direct physical contact, so if you hug a person or kiss a person. We've had several individuals who go to church and they love to hug at church. I'm guilty of that, but I haven't done it since COVID started. That counts no matter the time period. If it was just for a second that you reached in and you hugged someone, that person is now a close contact if you convert.
Yeah. The criteria with the uptick in things, is there not changing the criteria, but I guess urgency to get more testing done, just to try to dampen the outbreak?
Well, what we want to do, what we're hoping is happening here, is that individuals are seeing that there's an uptick in cases, and then they'll start to do more of the things that we know that works to prevent it. For example, and I know you're so tired of hearing this, I know people are tired of hearing this, their ears are probably numb from hearing me say, please put on your mask because it works. The face covering works. There's enough data out there now that proves that they do work. Physically distancing with that 6 feet or more is great. Washing your hands frequently, 20 seconds or longer, cleaning and disinfecting those frequently touched surfaces. And the holidays are coming up. So we really want people to avoid those large family gatherings that happen around the holidays.
I mean, it would be devastating if you lost a loved one that attended those. I mean, it would be absolutely horrible. What about some of these closed-in areas, nursing homes, detention centers, facilities where they really can't go anywhere? And have we seen a new surge in those numbers?
I'd like to say that it's everywhere. It's in detention centers, it's in long-term care facilities, it's in child care facilities, we're seeing it in churches. It is everywhere. What I don't want individuals to get is a sense of safe. I feel safe because it's happening in the detention center, it's not happening out here. It's happening in the long-term care facility, I'm good, it's not happening over here. What individuals need to realize is that those places, as you mentioned, they're contained facilities. There's restriction of movement there. So what usually happens is that COVID is brought in to those facilities. So you have individuals like staff that may work there who goes home, go out into the community, and then they come to work. We have vendors who have products that they bring to those facilities. They come in, they drop those off, and then they go back out into the community. Those cases in the long-term care facilities, the detentions, are just a reflection of what is actually happening in the community. Individuals should not feel safe because it is just happening in these places. It is everywhere.
Are you all currently hiring any positions to help with this uptick of numbers and things? Is there funding for that for your office?
Well, we are always looking for additional contact tracers. And those are the individuals that I mentioned earlier that help to make those calls and help to tell people they need to quarantine and isolate. That is probably our biggest need right now.
Now, is there a change in the policy in regards to isolation and the length of time? And I didn't know if, and the reason I asked that is that we are familiar with someone that had COVID, and from the time he had it to when he could return to work, he was told to date it from the time he started exhibiting symptoms, outward symptoms. Is that still the standard?
So there's a couple of different things about isolation that I think people don't realize. There's like so many different scenarios that you could do here. If a person is positive for COVID, when we look for their close contacts, we go 2 days back. Because you can be contagious 2 days before symptoms start or before even testing, right? Okay. If an individual, for example, lives in a household with a confirmed case of COVID but can't isolate, their quarantine period starts at the end of that the confirmed case's isolation period. Okay. So that's extended, their quarantine period, and I don't think a lot of people understand that. So it just depends on the situation. That's why that contact investigation is so important, because we get as much information as we can, and then we determine what the quarantine and isolation periods are. If people become symptomatic, for example, if you have symptoms and they worsen, it can extend your quarantine period. If you go into a quarantine period, we've had people convert at day 12 and 13, and the minimum requirement is 14. It can extend your quarantine period. It just depends.
Now, it's still pretty, the way that it attacks the body is still slightly different by individual, but we know for a fact that if you have underlying conditions, you are putting yourself at further risk.
If you have pre-existing medical conditions, if you have a compromised immune system, if you are an elder type of an individual, you have you have a more severe course of the illness. You could potentially have a more severe course of the illness than someone who do not have those high risk factors in place.
Wow.
Mm-hmm.
The other locations that were doing testing prior to this, are they still doing testing as well?
Yeah, this is just a supplement to what's already existing. Doctors' offices and clinics that were testing previously continue to do so. Because of the increase in testing, sometimes it can take a little while to get an appointment at those other areas. So this testing that we're providing through our agency should help a little bit with that, help ease some of that.
Okay, that's great. What about the hospitalizations? Where are we at the present time?
Well, I can tell you that since we are feeling an uptick in a strain in public health resources, it not only strains us, but it affects other areas of the healthcare system.
Do you feel that the community is going to buy into a vaccine when one is created?
You know, that's hard to tell. I can say that we've already seen comments about individuals not wanting to take the vaccine. And of course, that is their right not to do so. So we may have some resistance in some areas, but you know, just like most of the majority of the individuals want to quarantine once they found out, want to wear their mask, it'll be the same for the vaccine. I'm sure there will be individuals that want it and some that won't.
I seem to see fewer people wearing their masks out in the public, and so I don't know if hopefully shows like this will prompt people to do their due diligence and be a responsible citizen and take full caution for everything that you do and those around you as well. With the upcoming holidays in place, of course, we already see how Halloween is being changed locally. And then with the services for Thanksgiving and the Christmas season, Hanukkah, those types of celebrations, are there any words of wisdom for those? Do you not gather? Do you virtually? Do you? I mean, it's difficult. And of course, you haven't seen some of your loved ones since March.
Yeah, it's hard, isn't it? When you haven't seen your family in such a long time, it can be really difficult. And it just makes you want to, it can just be frustrating to not see your loved ones. I think the best thing that we can do for our family members if they don't live in our household is to keep them at a distance right now. Some high-risk activities that the Centers for Disease consider high-risk activities, especially around the holiday season, is going to the mall and doing shopping, because you know usually on Black Friday it is a mass of people. That's high risk. Attending these parades that happen during the holiday season, going to the mall and sitting on Santa's lap is not something that we would recommend. You can do your shopping online as much as possible. If you could do that online, staying at home doing your shopping online will help to protect you and help to protect others. We don't really recommend the large family gatherings for some of the reasons you just mentioned. I keep saying this, some of my favorite cooking in the world is my mama's. And for those individuals that have grandmamas still, that's some good cooking. But they are the ones who are at higher risk if they're exposed to COVID. And that's why we have to stress that if they don't live in your household already, you really need to maintain your distance.
We have been in this now for almost
October,
a year. I was going to say. But we're still learning.
We are.
And so the idea that we know what we need to know, we're still far from that.
It is so true. And I think people get really frustrated because we have learned as we went with this illness. Things have changed. We thought we knew what was best, and then the data starts catching up and the science catches up, and we've had to change it. And that's only because the data now proves that this is what we need to do in order to protect people. And so I think people get frustrated and maybe even a little angry at that. Well, you keep changing. It was masks before, you didn't have to wear a mask, and now you do have to wear a mask. I mean, what am I supposed to believe? Please, I think this illness, what we do know is that it's contagious and it's deadly. We see over 200,000 cases in the U.S. of individuals who have died. What we do know is that if you wear your mask and if you physically distance, it helps to reduce the spread, and it can potentially save lives. Until we get a vaccine, we're going to have to keep doing that.
Mm-hmm. You mentioned earlier 2 terms. One was community and the other was accelerated. What's the difference in those?
So accelerated spread means that it really breaks down to the number of cases per thousand in your population.
100,000.
Yeah, it is 100,000. So it really breaks down to the number of cases per 100,000 in your population. If it's accelerated spread, it's anywhere from 10 to 25 cases per 100,000 in your population. Critical spread is over the 25 per 100,000, and that's how they calculate the between the two, the difference between the two.
We also I wanted you to talk a little bit about the positivity rate. Mm-hmm. I know that you don't receive it locally, but the state does promote that. What does that mean, and what types of numbers are we currently having?
Well, the positivity rates kind of lets us know, one, how widespread it is in the community, and we know that it's widespread. Yeah. So and it also lets us know, the more you test, as the governor has mentioned, it kind of decreases that positivity rate because you're testing more. When you look at your testing, your positivity rates, we are steadily inclining. If you listen at the governor's updates, this weekend's case reports, the number of cases were probably some of the highest that we've had to date. So the positivity rate just kind of lets us know, one, that it's widespread, and two, it does another thing too, because you're testing. The testing that is done because you want to see how much is in your community also helps to identify those individuals who do have COVID, and thus they can be quarantined and isolated quickly. How
easy is it to catch it now? Is it still the same, in terms of it's pretty viable?
It's contagious.
Yes.
It's very contagious, yes.
Have you seen other diseases or viruses that are increasing?
Well, it's flu season.
Right.
So we are starting to see an uptick in the flu cases. Now, I have to share this with you because I was listening to a webinar maybe 1 or 2 weeks ago from the Department of Public Health. They looked at what the impact of physical distancing did to flu cases, right? And so they started looking at it from the time that the governor started closing things. And then they did that with the physical distancing. They were able to monitor that some kind of way. It dropped the flu cases almost to it really reduced the number of flu cases. So we know that the things that we're doing for COVID-19 will also help reduce the cases for flu.
Now, are you also providing flu vaccines?
We are not during these testing sites. We're not providing flu vaccines during the testing site. We do encourage individuals to reach out to their providers because and the local pharmacies, a lot of them are already advertising that they have the flu vaccine available.
And again, for those at home, there is no COVID vaccine.
There's no COVID vaccine right now. No, what we do is we physically distance, we mask, we wash our hands often, we disinfect, frequently touch surfaces, and hopefully we won't be going to any large family gatherings over the holiday.
Right. If you have already been tested a few times, okay, because of the individuals that you're around, should you get tested again?
Please remember that your test, the time that you had that test was just a point in time. So you could have been exposed again. So it is possible to get retested again. One COVID test in the whole 7 months here does not mean that you are good to go. You could have been, because it is critical and rapid spread, you could have been exposed at another time. Mm-hmm.
Is there anything that we haven't touched on, Terry, that it's really important to get out to the community?
No, I just really want to emphasize, and I can't emphasize enough, the holidays. Really want to get that out. And I hope that people will limit their holiday celebrations to their immediate household.
Well, and for those that may not be technically savvy, for those of you that are, you can possibly help those individuals make those virtual contacts because the holidays, for many, they can be a depressing time, especially if you don't have loved ones around you. So having this as an extra burden and a worrisome thing, It can be really bad emotionally for people.
It is, and we're asking you to quarantine and isolate even from your family members, when you, in your household, when you do get it. So I understand that. I do want to say this. There is one more thing I want to say before closing, is that as I mentioned earlier, there's a delay in when we reach out to you. One is due to the lab reporting system, and then because of the uptick in cases, it has delayed, it has also slowed that process down. While you're waiting on us to call you, we ask that you quarantine or isolate in your home. And that means not going out in public. We don't even want you to get in your car and drive around just to do sightseeing, because what if you need gas? What if you're in an accident? Then you are potentially exposing other people. If you're the one with the confirmed case, you really need to separate from your family members. You need to be in your own room if possible. You need to have your own bathroom that you're using. If that's not possible, you're going to have to really clean and disinfect that bathroom, that area where you are going, where you have to share with other family members. If you have to be in close contact or you have to come in contact with other family members, you must wear your mask even in your own home. If you are a case and you are quarantined, you're isolating, from contacts in your home, from individuals in your home.
We've all been kind of using our fancy different types of masks and things and such. I said that's a whole new business that's probably up because of this. And hand sanitizer, those things you would say. Again, for individuals that want to get information, tell them where they can get information.
Please go to our website. We have really good information there, LTDHD, which stands for Lincoln Trail District Health Department, ltdhd.org. We have a beautiful dashboard on there that can update you on the number of cases. We update that dashboard, at least the overview tab, which talks about the district as a whole, Monday through Friday. Usually it's done by 4:30 in the afternoon. It breaks it down by demographics, symptoms, exposure. All of that information is on the webpage. You can also go to the state webpage at kycovid19.ky.gov.
Great. And also on the Hardin County Schools website, you can go there and see the total numbers of student or staff members that have been infected but are back at school already or are currently isolating. And we're really pretty pleased that it's not as high as we expected, which is a great thing. Out of 17,000 staff members and students, I think we're doing a pretty good job. And
well, I do want you to keep in mind, too, about that. Yeah. It's that with every case, there is usually quite a few close contacts. So the close contacts will usually far outweigh the number of contacts, the number of cases. And that could take out potentially, depending on circumstances and where people were sitting and everything else that goes into that contact investigation. One case can take out quite a few people. And so we just want people to be diligent as they go forward.
Right. Well, thank you again, Terry,
Welcome.
For the work that you do and that the Lincoln Trail District Health Department provides us in this community. And for those at home, please reach out. Go get tested. It's a faster test in terms of, it's probably still a little bit uncomfortable, but and for individuals that may have transportation issues, there's really nothing that you all can provide for them, but maybe a neighbor or something like that.
The locations that we've chosen hopefully will assist in some of that transportation so that people can just walk to, if they need to, walk to the testing site.
Okay, great. And again, stay safe at home. Wash your hands, wear your mask, socially distance, and avoid big crowds, especially people that you don't know. You know, and probably shop virtually and not go into the stores on Good Black Friday. So, again, thank you, Terry, for coming in, and thank you, community, for joining us today. And we want you to stay safe and stay healthy.